like pregnancies can differ between each person and each baby. Like it can be different. And I don't understand why doctors just treat it like it's one set way and there's no other variation when there's so many different variations of pregnancy and how it presents itself. The WIC approving of our card and stuff has been a blessing. And I'm really excited about that because I know it might not seem like much for some people, but it's more than sometimes I've had. So I'm very grateful for that. And I'm grateful for the interaction I had with the WIC lady, who she even said it's really heartbreaking when people ask her if she's pregnant because she looks that pregnant, and it's really just how bloated she is. And she had said that after I shared that I kept bloating. Like I'd be really skinny, and then all of a sudden that day I would bloat like I was very pregnant. And that had me convinced that I was pregnant. And when I found out that a stealth pregnancy can occur and you can have tight ab muscles, and depending on where the placenta is and how the uterus tilts and things like that, you might not have a bump show at all, or you might have one and then you might not have one. And that's been my case in this pregnancy, is that I have a bump sometimes and sometimes I don't. And it's been confusing because for the last year I was also been having major bloating that made me look pregnant as well. And so yeah, but she said that she went through years and years of pain, and doctors just didn't believe her, didn't listen to her. I found out she had cysts, you know, and then they wouldn't remove them when they should have. And she was like, well, anything over 7 centimeters needs to be removed. And it's just insane that you have a 3-inch mass now that hasn't really, I don't have a surgery scheduled. They're like, they're not really eager to take it out after I'm pregnant. They're just like, let's just see if it gets bigger. I'm like, it's getting bigger. It's gotten bigger. Like, please take it out. Spoke to me was just such kindness and understanding. And wow, like your experience is so real and raw, and you kept going to doctor after doctor, and you believed that there was something going on even when they didn't, and you believed in yourself even when the people who seem to have more knowledge about this than you do were saying, no, that can't be it. And you said, no, I know what I'm experiencing, and I will keep going to the next person until they believe this is what I'm experiencing. And, you know, it took literally getting pregnant for them to start recognizing the issue. That's all I'm going to say. But my heart just felt complete yesterday. And I should be able to walk away from a doctor's appointment feeling the way that I felt when I had that conversation with that WIC lady. And she said, she suggested I go to this certain doctor, which was just amazing that she said it, because that was actually the doctor that I just got referred to when I saw my midwife, my second OB appointment, since I found out I was pregnant at 14 weeks. Now, they said I was just 9 weeks, but then I got billed on my insurance for a 14-week pregnancy. I'd like to add that this ultrasound tech was very rude with me, and I believe she was discriminating against the size of my belly because she saw a baby much larger than my body looked like it could have. This is typical of stealth pregnancies, and it's possible she didn't even get a clear image of the baby. She just saw the placenta and was like, well, we know there's something there, and so we're just gonna say 9 weeks. Literally 4 weeks later, I go in and they still considered me 9 weeks, 4 weeks after I was told I was 9 weeks. And I was like, okay, well, counting 9, 10, 11, 12, 13, I'd be like 14 weeks right now, correct? And the ultrasound tech again said I was 9 weeks a month later, a different ultrasound tech. And she didn't even look above my belly button. She actually did a vaginal sonogram instead. So the second sonogram I had was vaginal, because she said, oh, who said that? The doctor said you're 16 weeks? Well, we're going to do a vaginal sonogram because I don't think so. because I wasn't bloated like a 16-week pregnancy, because anytime I go into the hospital, I have insane amount of anxiety and I tense up and my stomach disappears. It's crazy, but it's true. It's real. And things like this can happen to people who have PTSD, people who became pregnant in abusive relationships, who feel like they have to hide their pregnancy. They will literally not have a bump. And I really wish doctors would understand that just because I don't look like it doesn't mean that I'm not. But anyways, it's weird because then I was given a 16-week test and they're like, oh, this won't work unless you're 16 weeks. And then it worked and I found out the gender of my baby. And I'm like, so if you're giving me tests that say I'm this far along and my HCG levels are reading this far along, but you're not willing to do an ultrasound above my belly button because I don't look like it, but everything else is reading as if I am. So it's like skinny discrimination, I feel like what the fuck? And all these ultrasound techs are super overweight, so they're just projecting their insecurities, being like, that's impossible. Like, you see it on the screen, it's possible, or you're not seeing it on the screen at all. And they've been very sketchy about telling me how far along I am. I've had 3 sonograms and they have not let me see the screen. They tilt the screen away from me and don't let me see my baby. So I've had 3 other people see my baby and I haven't yet. And they will not give me an ultrasound until I am ready for my 20-week scan, which I was ready for my 20-week scan this week. However, they couldn't schedule me until next month. So also my due date has changed 3 different times. First they were saying the end of November, then December, now January. Yet no one has done an ultrascan above my belly button. I'm told that the first ultrasound is going to be the most accurate at 9 weeks. And I said, okay, but what if I got an ultrasound way further than 9 weeks? Then it would be less accurate. Also, ultrasounds are not that accurate. Ultrasounds can be a month off. A month. Okay, if they say your baby's going to be 9 pounds, your baby could be 10 pounds or 8 pounds. They say you're 9 weeks, you could be 14 weeks, 16 weeks, or maybe even just 5 weeks. That ultrasound is not completely accurate for measurements. And they keep going off of my last period, but I keep thinking, I think it just bled a little bit in my first trimester, and I actually became pregnant around January or February, meaning that I'd be due in September or October, not January. And they keep changing the due date, which I think is weird. And I'm like, okay, but when you confirmed my pregnancy, I was feeling kicks. So I knew I was all the way into the end of my 2nd trimester, probably into my 3rd. When they measured the dermoid cyst, my doctor said that those sonograms aren't always accurate to measurements, so it might not actually be that big. But then why aren't they using that idea with the measurement of the baby? Because if doctors really talked about how inaccurate sonograms are, that would mean they'd have to admit that they were using an inaccurate method of measurement to convince women to get induced because your baby's too big or your baby's not growing, fetal growth restriction, or all of these things that they do to get you induced and, you know, rack up your bill even more by saying these things. An example, I knew someone who was told their baby that their baby was too big and they needed to get induced because they wouldn't be able to push it out, and then their baby was born a preemie because that's how inaccurate these measurements are. So I just wish they would understand that when they say this much, it's an estimate. It's an estimate, like a huge estimate that could be 3 to 4 weeks off. And they keep going off my last period, and I'm like, okay, but what if I just bled a little bit during my pregnancy? Because I've had other pregnancies where I bled during the pregnancy. And when I made this last appointment, they're like, okay, this is your 20-week appointment. And when I called to check for that 20-week appointment and to see if I could get my ultrasounds moved up, she was like, okay, so you are 18 weeks here, it says. And I'm like, no, I'm 20 weeks. And so I've been so confused by why they keep saying different things, and the things they're saying don't align with my experience in my body. And it's probably because when I got my 2nd ultrasound, that's when I found out the gender of the baby. They did blood work that you get done at 16 weeks so that you can find out the gender of your baby and if there's any abnormalities, genetic defects and stuff. All of that was fine. We did find out the gender. We're not going to reveal it yet. I still have to tell my son. my firstborn.